Cleaning the instruments. Instruments should be cleaned as soon as possible after their use. 4 bowls cleaning technique should be followed, in which the instruments are first brushed with a soft toothbrush in first bowl containing mineral water with disinfectant, then rinsed in 3 bowls containing mineral water. This should be done even if the ultrasonic cleaner is used. Cannulated instruments are first flushed with distilled water 3 times and then with air 3 times before packing. Phaco probe and tubing are cleaned in cleaning mode of phaco machine to remove residual tissue and water droplets. Irrigation and aspiration handpieces are flushed thrice with 10 cc distilled water. It is repeated thrice with air to remove water droplets. Packaging and loading the instruments for sterilization. The instruments are then dried with clean towel, tipped with plastic sleeve, and are segregated into separate sets. They are then packed in individual perforated stainless steel trays, which are placed in the bins with indicator. 3 indicator tapes should be placed inside, 1 in the bottom, 1 in the middle, and 1 at the top of the bin, and 1 on the external surface of the bin. Tight packing is avoided to allow steam penetration. Phaco probe and tubing are packed into trays for steam sterilization. Care should be taken to wrap the tubing and handpieces separately in a cloth. That is, the metal components should not come in contact with the wire. Sterilization. Sterilization by heat or autoclaving is the most popular method because of its simplicity, reliability, and accuracy. It is cheap and environment friendly. Autoclave. Almost any particle which is heat stable can be sterilized using the autoclave. Pre-vacuum flash autoclave. And has a holding time of 5 minutes at 134 degrees Celsius and 30 pounds pressure. Gravity displacement autoclave. This requires a holding time of 30 minutes at 121 degrees Celsius and 15 pounds pressure. After hand washing, remove the drum from the autoclave machine. Immediately close the window of the drum. Cleaning of OT. Daily cleaning. The OT walls up to 6 feet height, floor and doors are wet mopped daily with 1% sodium hypochlorite with 2 bucket technique. Operating microscopes, lenses should be cleaned. Its head cleaned with Basilol 25 spray daily and covered properly. Trolleys, revolving chair, operating table, footstool, IV stand are cleaned with 1% sodium hypochlorite. Scrub area should be cleaned 5 times with 1% sodium hypochlorite solution daily. Weekly cleaning. All the equipments, furniture removed from the theatre. Fans, lights and clocks inside the theatre are wiped with 1% sodium hypochlorite solution. AC filters must be cleaned with detergent solution and dried. Scrubbing the walls and floor with detergent and mopping with 1% sodium hypochlorite. Monthly cleaning. As per the weekly cleaning method, particular attention to be given to corners and edges. Additionally, microscopes, revolving chair and trolleys are cleaned and oiled where necessary. Fumigation. Aerosol machine or fogger should be used for fumigation. Equal amount of formalin and distilled water is added depending upon the size of the theatre. After fumigation, close the theatre for minimum 24 hours. hydrogen peroxide 1% and silver nitrate combination or glutaraldehyde and formaldehyde combination can be used as a change fortnightly. Monitoring. Monitoring environment. The bacterial carrying particle load in theatre is checked by sedimentation plating technique every fortnight. Monitoring of sterility. Periodic culture is done once in a week from sterile areas and items such as trolleys, microscope knob, viscoelastic cannula, saline, drum, surgeons and assistants' hands and gown, unsterile areas and items such as walls, microscopes, floor, operating table and air conditioner. Nasal and nail bed swabs also should be taken at regular intervals and sent for testing. Monitoring sterilization process. Chemical monitoring. The autoclave strips should be checked for its color changing to jet black and autoclave strips register should be signed by the theatre in charge and the operating surgeon both after pasting in the register. Once in a week, Bowie Dick test pack or vapor line indicator can be used. Biological monitoring. Biological indicator ampules are to be put in the load along with other items, generally done once in a week. The autoclaving person should not be aware of its use. Monitoring of activities. All the activities must be monitored carefully by using various checklists like preoperative checklist, daily cleaning checklist, weekly cleaning checklist, monthly cleaning checklist, weekly nail checklist, weekly autoclave report, autoclave logbook, autoclave strips register. Monitoring all these activities are done at weekly meeting.